So I'm going to start the meeting at 7:06 p.m. A call to order. Welcome to the Board of Health, June 10th, 2025 meeting at 7 o'clock or 7:06 now. And number 2 on our agenda is approval of the meeting minutes. Board, if you take a look at our 2 sets of minutes, April 28th and May 1st, if you have any comments about that.
If nobody does, I'll make a motion to approve the minutes from April 28th. I'll take them separately, or do you want to do them together?
You want to do them separately, Roxanne?
Sure. I'll make a motion to approve the minutes from April 28th. Do I have a second?
I'll second.
Okay, all in favor?
Aye.
Aye. Okay, and I'll make a motion to approve the minutes from May 1st, 2025.
I'll second.
Second. Mary, second. All in favor?
Aye.
Aye. Okay.
Thank you, Board.
Yep, next is citizen speak. So we're going to allow 3 minutes for anyone that would like to speak for citizen speak. And just raise your hand or let Caroline know and she'll call you. Thank you.
And just before everybody speaks, I just wanted to introduce the board and myself and my staff so everyone knows who we are as we're running the meeting here. I'm the health director, Caroline Kinsella, and my staff, Emily Connors.
Hi, I'm Emily. I'm the assistant health director.
Carolyn Ho,
Hi, I'm Carolyn. I'm the health agent.
Jean Peterson.
Jean, you're on mute.
senior clerk. Yep. Jean. I'll speak for Jean. Jean's our senior clerk. Mary Stenson. Mary's on mute.
Sorry. I'm sure my family wishes they could mute me sometimes. Mary Stenson, secretary.
And Laura.
Laura Richards, member.
Roxanne.
Hi, Roxanne Musto, chair.
Okay. Okay, before we move along to number 3, citizen speak, I just wanted to update everybody about beaver trapping and the beaver trapping season. So the beaver trapping season is January 1st, 2025 to April 15th, 2025. And then, so we're not in beaver trapping season right now. And then beaver trapping season will start up again November 1st, 2025 to April 15th, 2026. So I just wanted to preface that before everyone starts to speak. So if you would like to speak, if you could raise your hand and I'll call on you, that'd be great. And I see that Roy Chambers has raised his hand. Go ahead, Roy.
Yeah, hi, my name is Roy Chambers, and I'm here really just to hear the presentation from the DPW relative to the problem with the beaver in the Highland Street area. So I think probably any discussion I would have would be after their presentation or questions I may have.
I know you sent a presentation in to me this afternoon, Roy, and I forwarded it to the board. I'm hoping that you got it, board. I just wanted to let everybody know on this meeting that trying to get into this meeting tonight, I couldn't get in properly to the meeting. So we have a way to access our files when I'm talking to you on this meeting, but I couldn't get into the V drive, which I've never had a problem with that before. Been trying since 6:30 to get in, so I can't pull up my information. I'm going to try to pull up some of the emails that were sent, but this is disappointing that I can't pull up the information and show pictures. But I know the board, I sent a lot of information already to the board, so they should have all these pictures. So bear with me when we're going along here. I can't get into the drive, and my assistant health director cannot get into the drive either. So there's a glitch going on here. Thank you. Did you want to speak now, Roy, for a couple of minutes about your concerns?
Well, it's an ongoing issue that we've been experiencing down that area for several years. I followed the beaver in that area for almost 5 years. And we didn't really have any trouble with them until last year, when the DCR made a presentation to the board wanting to trap the beaver at that time. The board had voted against that since there wasn't enough proof that the problem was caused by the beavers. And then now we're back here again with a similar issue. But this time, I think that the town definitely has some concerns on this. And I've talked to John from the Conservation Commission last year with Steve Ivers, and we've looked at the area. And at that time, the beavers had established another a dam further on down by the Highland Street Bridge. But we decided at that time that we'd let nature go its way and see if the brook itself would wash the dam away, which it did. And that was back in October. From October through right up until April, it wasn't a problem. Didn't seem to be a problem in the area. Only after the small amount of rain that we had from January till April, the beavers took advantage of it, and they have put together a pretty good size dam right now by the Holland Street Bridge. So, of course, you hate to see this kind of thing happen, because the remedy is one that people like myself who like to let nature go its way, to have them be removed from the area. But I don't know, it seems to be the beaver are running out of time on this. But I'd like to hear what the DPW has to say. I know they had also talked about the lower part or the upper part of Highland by the Uncrity Dam. But that area, in my opinion, is not caused by the beaver. It's an engineering, has been for years.
Thank you, Roy. Is there anyone else that would like to speak or citizen speak? Raise your hand. I don't see anyone else. Okay. Oh, I see Ned. Ned, would you like to speak?
Yes, thank you, Ned Corcoran. I just a question. Roy spoke just at Citizen Speak, and you indicated that he sent some materials in with perhaps some photographs. Does he have the possibility to share his screen and present those photographs from his laptop or his computer, as opposed to you having to find a way to pull it up on your own drive?
Well, I do have photos. I don't know how well they'll show from my iPad here, but I don't know if you can see that.
I'm just wondering whether you can allow him to share his screen.
I can. Can you?
I don't have it on an iPad. Separate
You don't
from
have,
the
okay.
screen.
Then, so you don't have the capacity to show it on the screen.
I can share it, Caroline, if you
Oh,
want.
that'd be awesome. Thank you so much.
Do you want me to do the presentation, and then I can share Roy's information, and then Roy can speak on his information, or do you want me to? How do
Do
you
you want me
want
to?
to?
I can
proceed?
move on to number 4. It doesn't seem like anyone else wants to speak at Citizen Speak, and you can do the presentation first, if that's okay with the chair. And then we can maybe have a couple of comments after that.
Yes, I think that's
Is that
fine.
okay with you? Okay, so we're going to move on to number 4. The Department of Public Works is requesting a 10-day emergency beaver permit to trap beavers in the Pine Tree Brook area due to concerns of Harlan Road washaway, standing water, flooding, and threat to human health and safety. Discussion and vote. So if you could share your screen, Marina, that'd be great. Great.
Good evening. My name is Marina Fernandez. I'm the Director of Public Works here for the town of Milton. First of all, I just wanted to thank the Board of Health for your time and for listening to this presentation. So I really appreciate all of your time. I put a very quick presentation on the problem, on the issue we have at hand and the request. I have respectfully submitted a permit to the Board of Health for, it's called an application for 10-day emergency beaver or muskrat permit. That application was submitted on June 5th. To give everyone a little bit of a background, the Pine Tree Brook Flood Control Dam is a structure located at the Harlan Street, at the connection of Unquity Street in Harlan. That structure was built around the 1960s by the USDA in response to floods that were happening throughout the state and throughout the country, and given the funding mechanism that was available back at the time. The town that structure does require periodic maintenance, and the town of Milton DPW has been in charge of the periodic maintenance, which includes clearance of the area around the dam, the DCR and the surrounding berms and streamways to keep the structure's integrity. But other than that, it just pretty much just work on its own. And the DCR lists this as the Pine Tree Brook Flood Control Dam. Basically, it works as a structure to allow the land behind it to be used as a detention basin during a storm. And it allows the water to slowly go downstream after a storm event. However, currently the level is 2 feet of what the current capacity is. Basically, there's 2 feet of water that is on top of what it usually stands, and that takes up very crucial capacity during a storm. So it does not allow the water to back behind the structure, because behind the structure it's already working at its full capacity due to the beaver dam. To give you a sense of what that structure, the watershed behind that structure, it really splits into two, where you see, I don't know if you can you see my mouse? All right. This is the location of the Pine Tree Brook Flood Control. The Pine Tree Brook goes over here, and these areas are the Harlan and Unquity location. Just upstream of that, not too far upstream of that, right here is where and I have another picture coming up that will give you a little bit more of a zoom. That's where the very large beaver dam has been constructed over the months, as Mr. Chamber has indicated. And just upstream of that structure, the Pine Tree Brook further splits into what we call the Harlan Street watershed, which is a 2.9 square miles watershed, and the Unquity Street watershed, which is an area of 4.5 square miles. So we have several beaver dams that have been built over the years. I would say that this activity has been going on for a little while. However, it's hard to tell, because from what I have heard from experts, some of the beaver dams can really, even a structure as large as the one that we found that you can see on the picture here, which is pretty large, it can go up within 3 weeks at a time, depending on the activity that is happening. So some of the dams are located within DCR, which is just downstream of, let me just go back. It's this area over here behind the Unquity tree, and the Unquity ice rink over here. This is the area that is shown here. And the DCR has indicated that they found several beaver dams. And the other location, it's over here, which is the one located at the town of Milton land. We also have seen additional activity just upstream inside the Harlan Street culvert location. We see indication of beaver activity there as well. So what is happening is the Harlan Ave is pretty much being run. It's being washed off. I'll show you a little video. It should play. This area here is on the left is the watershed that comes. It contains the Wollaston Golf Course in that area, and our dam is on this side of the video. The DPW attends to this area during every storm. As far as 2 weeks out, we attended the nor'eastern that came in the month of May. During that event, the road was closed for a 3-day period. Our staff had to attend this road overnight. We worked during an emergency shift to close this road. When this road does get washed off, there is the threat that people, if they were to drive and go past our barriers, that they could, their car could capsize onto the Pine Tree Brook, causing serious threat to people's lives, as well as even potential risk factors to the future risk factors to the environment. This road needs to be accessed by emergency personnel. We do have a school bus line that goes through this road. Like I said, it requires road closures. In the past 15 days alone, there has been over 4 days worth of road closures on this road due to flooding. And also it requires immediate response from our DPW staff. It requires overtime and requires us to be out there in the middle of the night, making sure that the road is closed and people are not going through. And again, there's still the possibility that if we're not there to attend, which sometimes we're not there for 24/7, that people or maybe young drivers could go through. I did reach out to different solutions. We reached out to the town of, we reached out to Beaver Solutions LLC, which is a local service provider to put in the beaver deceivers. However, and this was submitted to the board. However, those are not suitable. We got responses back from the wildlife saying that these are not suitable solutions for this area. They were very aware of the problem, but due to the flow volume being too high, and even the largest beaver dam leveler pipe would not be sufficient for this area. We also got similar letters from the DCR areas being not suitable to have a beaver deceiver put in. And in addition to that, the vertical difference in water level is not deep enough to have these to be effective. So that is my presentation. If you give me a second, I'll stop sharing and then I'll share Mr. Chambers' photographs, okay?
Thank you, Maria.
I think we're talking about two different areas. You're talking the area down by the Unquity Dam.
Yeah.
And there's beavers down there? There's a dam, there's a beaver dam down there?
I can go back to my presentation.
Okay, okay, you understand where the Holland Street conservation land is, correct? Which is on your photo would be to the left. Right?
Yeah, hold on, let me go back to the PowerPoint. Can you see this?
Yes, I see
Correct.
that. Go
The
on.
request here is for, the request for the permit is for both the areas within the DCR, which is where I am. We found the 3 different beaver dams, as well as this area just upstream of the Pine Tree Brook flood control dam, which is maintained by the town of Milton. And then we also found activity just upstream here towards the Wollaston Golf Course. We have evidence showing that there is beaver activity in all 3 areas. And my concern as the DPW director is that if we just look at this as a one issue in one area, what is going to happen is we're going to allow, once we trap the beaver, and if we are successful in doing so, we would reach out to the Conservation Commission and request guidance on how to most properly remove the beaver dam, which would then allow water to flow naturally where it's supposed to go. And it could therefore create a further down, issues downstream. So if we were to, it all works as a bottleneck. So if we allow the water through here, we could be causing further flooding downstream. This picture over here was actually taken during the northeaster, and as you can see, the level of water here was just about 6 inches from the top. And this is with the beaver dam holding up additional water just upstream. So if that beaver dam is to be let go, and without taking the restrictions further downstreams, you could be causing additional problems even on Unquity Brook, similarly to what is happening to Harlan.
Well, my question was the water flow that you showed that flows over the Holland Street area by the Unquity Dam is coming from the conservation land. Is that correct? Or are you
It is
indicating?
coming from the watershed, the map that I showed you, which is 4.5
Okay, we're talking-
miles on one side and 2.9 miles on the other side. You're correct.
that's-
So it is the map that was shown. 1 second, let me just pull up your, I apologize. Let me just found your. Caroline, you sent, could you send me the pictures so I can share the pictures here with the group? I apologize. I thought I had it. I don't. So I apologize.
Well, I'm not disputing your presentation. I was just trying to get an idea at the Unquity Dam that you claim that there's a beaver dam. Is it on the Holland Street Conservation Land area? Or is it further upstream heading toward Chickatobit?
Just sent it, Brenda.
Because that's where the flow comes from. Pine Tree Brook starts up near the Chickatobit area at Hillside Pond and flows downward to the Unquity Dam. Are you saying there's a beaver dam between the dam and Hillside? Because I'm not aware of that. And like I said, I've
I
been.
can show you again on the map.
Yeah, okay. All right. And again, I'm not trying to dispute your presentation. I'm just,
No, yeah, I am.
or argue with you about it. I'm not. Because the area I was in concern of was the lower end of the Pine Tree Brook that goes out toward Canton Ave by the Holland Street Bridge. That the water is backing up there.
Do you see my
Yep, okay,
screen?
yep, okay, move it up. All right, that's what it originally looked like at the Holland Street Bridge last year when we came to the Board of Health. That eventually was removed by the DCR. At that time, everybody agreed that this wasn't totally caused by the beavers. But it was removed, and if you continue on down, you can scroll further down. Okay, this was what it looked like after the dam was, the DCR cleaned it out, which you can see it's beautiful. And the water was flowing along. Can you scroll down a little bit more? Okay, this was in December. Okay, that was December, and you can see in February that the dam or the brook was cleaned. Now here we are on May 13th, and you can see that the dam is started to form right there. And if you go down a little bit, the next one, that this was taken on June 6th, you can see they have stopped the flow. And this is where it backs up into an area that normally doesn't have water. It's now flowing into that area. As you can see, it's standing water there. And this is this is the area that we were just talking about down by the Unquity Dam. You can see that the 3-foot piping that goes under Holland is all clogged up.
Yeah,
water.
the location that I am just talking about is, so the pictures you just showed are just over here. That's the DCR land beaver dams. The location that I'm talking about in the picture you took is from this road.
Yes.
There is a much larger structure that is cutting across here. Mr. Kernans, who was on this call, saw this with, and I'm not sure if he wants to add to this conversation here, but I would say it's about 60 feet across, blocking this area. And that is also an act, that is where also one of the areas that we're asking for a permit. And the picture looks like this, and I apologize if this is, it doesn't do its justice, because all you see is trees and falling trees that look like debris. We did invite the Board of Health. Caroline also saw it, right, Caroline?
Yes.
Earlier this morning, I had our staff go up and take more pictures for you guys. And just, we weren't able to do that because of the vegetation had already blocked much of the view. I also believe that, yeah, so we definitely seen the visual of all of those dams. And again, if not, we are looking at more rain events, meaning more washed out potential roads. We know that's gonna happen. And we know that could continue to pose a threat to the area. So it was very important, and I urged the board to make a decision at this meeting, because we are looking at more rain events with this high groundwater condition. So I urge the decision to be made at this meeting.
Thank you,
Um,
Maria. Roxanne, how would you like to
Yeah.
proceed? I see
So
that Ned has
Ned
raised his
is-
hand, but do you want to again bring up citizen speak? Or is the board
Let's
going to
first,
speak a little bit?
I think that Ned has his hand raised. Let's listen to
Right.
what Mr. Corcoran has to say, and then let's open it up to the board next. And
Okay.
then if there's any follow-up, try to limit it a little bit, because we've had a lot of back and forth right now
Yep.
on this, so I want to let the board have a chance to weigh in. So I'd let Mr. Corcoran first.
Thank you very much. I appreciate that, Roxanne. For the record, Ned Corcoran, I'm here on behalf of Wollaston Golf Club, which has filed a memorandum in support of the town's application. I think it's really significant to point out that, there is a state law that authorizes the beaver trapping. And I think it is clear recognition that beavers cause this type of damage, and that unfortunately they need to be removed from time to time. I think just simply efforts to remove their dams isn't going to remove the beavers from the area. And if you look at where they were last year from Roy's pictures and this year's from Marina's, it looks like they're back. And they move quickly, and they're creating quite a problem. If I can share screen briefly. Can we all see that? Can you see? Okay. So this is similar to what Marina was showing. This is the Harlan Street Conservation Area, the 2.9 square miles, and this is the other that is the 4 square miles. They both merge into this location. Pine Street, it's 2 large watersheds that are coming into one place. And the Unquity Dam is the control point that lets the water out so that all of this doesn't back up. Wollaston Golf Course is part of the watershed. These ponds abut this conservation area and drain off into this area and come down into the Harlan Street area. These fairways are being overrun with water because there's no place for the water to go, causing significant damage and a significant expense to the members of the club to maintain those fairways. There's also, just to the right, connecting this pond on their property, is their main driveway in. There is a slight bridge over here, but they're concerned that there might be enough backup to create a damage problem here or here, allowing access to the clubhouse for emergency and other vehicles. And the last point I would make with respect to what's happening is that this is Wentworth Farms Road, which is a new cluster subdivision that was recently built. This is Ford Ranch Road, also comes up. They abut at the end to the watershed area and to the conservation area. They all have septic. None of them there is no sewer in either of these two areas, then there's a concern that some level of backup could affect the septic systems that are closest to the wetland. And so that would become a health issue. That would become a significant problem. It would affect the wetland itself if there was some leaching out of the septics caused by flooding, groundwater coming back up significantly into the area where the flooding is. So the fact that there's a state law that authorizes this really tells me that this is a significant issue. It needs to be dealt with, and the state has granted significant power here that is unusual relative to lots of other power granted to municipalities to address issues of public health and safety, the way Marina has described it. So we would wholeheartedly support decision of this board to authorize the beaver trapping as requested, and then would encourage the town to pursue a follow-on action for the removal of the dams in consultation with the Conservation Commission, which would have to issue an order of conditions as to how and under what conditions those dams could be removed. Thank you for your time. I appreciate your efforts, the things that are happening here, but really urge a favorable vote in this case. Thank you. And I'll stop sharing.
Board, would you like to discuss further?
Well,
Sure. Go ahead, Mary.
I can. I wanted to thank Mr. Chambers for following this issue as closely as he has, because I think he's greatly contributed to my decision that I'm in favor of removing the beavers. There was a level of tolerance because we've been watching this and everybody's been watching it for a while, and it seems as though there's significant safety concerns and health concerns that need to be dealt with, and I would be in favor of granting a permit.
Thanks, Mary. Roxanne? Laura?
Yes, sure. I have a few questions for Marina first. And I, would echo a lot of what Mary just told you. Marina, so you're looking at two different dams, is that true? And then I'm just wondering, when DCR came to us last time, that was on DCR. So what is DCR doing on their part? Because I think that it seems like this all has to be done in conjunction, right? I would think. So I'm just wondering, if Milton does something, what is DCR going to do here?
I have reached out to DCR, and it would be a conjunction permit, both for trapping on Milton land and DCR land. And they have confirmed that they would trap within the timeline that you provide. It would be similar trapping timeline. I would also ask that you allow the timeline to begin. Obviously, when I need to book the trapping. I don't have a start date yet. I was waiting to hear from this board first before, obviously, we booked any trapping. But trapping will be done in conjunction, and I have received confirmation that they would be working with us. So we would trap the area, and then, like Mr. Corcoran has mentioned, we would then reach out in conjunction. So it's the town of Milton working in conjunction with DCR to then receive the guidelines under an order of condition from the Conservation Commission to take down the dams, given that the trapping is done successfully, in addition to what Mr. Chambers has mentioned, which is proper clearing. So for the proper life and flow of the area.
Thank you. I mean, I wanted to say that I also appreciate the pictures that you both have provided, Mr. Chambers and Marina. And I think that there are a lot of public health concerns with this at this point. I think last time when we heard it, we were willing to give it a little bit more time and see how it worked out. But I think that it seems like, from what we're seeing, that it's become more of an issue and a significant issue. And I think it probably, from what I'm reading, it meets the criteria for this. So that would be what I would have to say. Thank you.
I agree with both Roxanne and Mary. I think it's reached a level where it has to be addressed.
Thank you. Would you like to take a vote, board?
Yes. So I guess I'll make the motion that we approve 10-day emergency beaver permit to trap beavers in the Pine Tree Brook area due to concerns of Harlan Road washaway, standing water flooding and threat to human health and safety discussion. And I mean, human health, sorry. And I would just say that Marina would let us know the dates of that. So it's pending those dates because she has to look at that. Is there a second?
I'll second.
Okay, all in favor?
Aye.
Aye.
And thank you. I would just add that Wollaston has offered to pay the town's cost for the trapping, assuming that there was a favorable vote tonight.
Okay,
Great.
so noted. Thank you very much.
Got it. Thank you.
Thank you.
Thank you. Thank you,
Thank
everyone.
you.
Thanks.
Thank you.
Thank you, everybody.
Thank you.
Thanks.
Thanks, Marina. Okay, doke.
All right.
All right. So moving on to number 5, the healthcare capacity audit letter and response from the state and discussion about that. And as you know, we sent out a number of healthcare capacity audit letters to the governor, Department of Public Health, and other state people that should know about this. And we only received one response, and it was from the Department of Public Health. And I sent you that. They haven't responded since then. So it kind of stalled regarding if they're going to be doing an audit, because they have not expressed that they are going to do it.
So just to add a little bit to that, the letter we had sent out was the end of January, beginning of February. We didn't get a response back till April. We had questions about some of the things that were cited in that letter. And at the end of the letter, it did say that if you wanted to discuss further, to reach out, which is what Carolyn did. She reached out to who they were asked to reach out to, Sam Wong, right? And sent an email, and this person had forwarded the email to somebody else saying that they would be better suited, I guess, or could answer our questions. And nothing. We have not heard anything back on that. And I do think it's a huge issue with this. I mean, it came to our attention from a resident, but since then, several residents have spoken to me about this. And firsthand, what I see in my job, I see this all the time because I go and work in rehabs and places like that. So I get patients coming in. So I see and I hear from the families of what's going on in the area. My patients go to all different hospitals within this area, not just Milton, so other hospitals as well. I think it's a huge concern. And I know that we actually have an upcoming town meeting. I would like to just let the public know what we've done with this, because I think it is really important, especially in the context of everything that's going on in town, and in terms of population growth and things like that, especially if the state is not addressing this issue, which, you know, is a huge issue and it's only getting worse. All you have to do is, if anybody's had an experience being in a hospital or know somebody that has people lining up in the hallways because they can't get a bed, waiting days sometimes. And you could even talk to any of your ambulance drivers, firemen, they would be able to tell you some of this as well. I think it's great that we have the hospital in town and that they're, you know, building some emergency room beds. I think that's great, but that doesn't serve the purpose of hospital beds. We've lost a lot in the South Shore in Norfolk County, and there's doesn't seem to be any plan to address this issue at the state level. So I think we should all be concerned about that. So that was what I was going to say. Anybody else?
What more can we do? As far as,
I mean,
Are
we've
any
been reaching
open
out.
forums or anything? I know there are some citizens that get together to discuss what's going to go on with Kearney, which I don't know what's going to go on with that building, but I don't know if there are any other forums or groups that are advocating for the same thing, and can we join them?
Well, I think we know that, for instance, when we sent our letter, Norwood reached out right away because, of course, they're trying to reopen their hospital. We
Right.
were just trying to encourage all of the communities to, get on board with having, requesting that the state do an audit to see what we actually have for hospital beds, right? And how many we're short, because we've had several hospitals close in our catchment area. And so at this point, I don't know, I think we have to sort of, that's why we were trying to reach out to the state for further discussion on this. So we were trying to do our part, especially for our residents in our town, and even residents right in this immediate area,
Yeah.
So I mean, it's a good point, Laura. What do you do, right? So we're
What do you
trying to, we're trying to do that.
They're supposed to be doing it on the state end through the CDC, Boston Public Health Commission. They're supposed to. They have a responsibility to study this, and
They have a lot of the data. I mean, you can go online and look at healthcare capacity,
I
but
have.
I don't know if they have it broken down. I haven't seen it by week. There's sort of more global numbers, but I don't know what they're doing with that. And my understanding was that the legislature wanted them to do something about it, but it was never signed into law. That's my understanding.
Mhm.
So I think that, we're just trying to do our best to get some answers, because this is a really important topic. It's only getting worse. And again, if you have gone to the hospital or know anybody and you hear the stories and it's not gotten better, it's gotten worse. And so that's why we're trying to chase it down and trying to get some answers. I mean, Caroline, do you have anything to add on that, or?
No, I agree with you, Roxanne. I'm thankful that the flu season wasn't as harsh as it could have been. There could have been a lot more problems. Like you say, we did have a milder season, but you're right. There's at BID Milton Hospital, they have people waiting a long time to be seen, and they have been lining up in the hallways to be seen. And a big loss at Kearney Hospital for mental health.
Right.
And so that's backing up into BID Milton Hospital also. You're right.
Yeah. And I mean, I know South Shore is, crazy too. I've sent people there and I have stories from the families there too. So it's really this whole area. But Milton, I hear I was talking to someone the other day, and she said that her mom was there waiting for a bed, like for a day or something. So, I think it's a problem for sure. So we're going to try to work on that. We're still trying to reach out and get some answers.
I'll reach out again to San Juan if you'd like to do and get some more answers.
Sure. Sounds good.
Department of Public Health. Okay. Number 6, amend the health fee schedule to reflect private wastewater septic system plan review will have a variable fee depending on the complexity of the septic system, discussion and vote to approve. I brought this to our last board meeting about the fees, and right now, let me open up my package here. Right now, as a septic system plan review, initial plan fee is $100. A septic system plan review for each revision is $50. So it doesn't compare to our septic consultant, Mr. Paul Brogna, who reviews our septic plans for us. And it could be as I was speaking to Roxanne, it could be hundreds of dollars. So I know Jean put together a list of all the septic addresses and the average spent. So the lowest is less than $100. The highest is 900. So they kind of settling in around $400 or $500. I see a couple of 665s, 675, two 700s, a 910, and a 900. So, you know, it's not covering. It's coming down to it's not covering the charges of Mr. Paul Brogna reviewing the septic system information, bringing it to the board, and having the board approve it. And we want to capture that, the money that's being spent. So the proposed language, and I spoke to Town Administrator Nick Milano, and I know that also Carolyn reached out. I'll back it up one step. Carolyn put together a list of how much does the other towns charge, and it's very similar to what we're charging, 100 and 150. Medfield does charge $330 for new construction. Needham does charge $400 for new construction, and Wellesley does charge $500 for new construction. So, as I said, Milton's about 150, Canton is 100. So it's kind of like between $100 and $500 that surrounding towns are charging. But we're looking at some new language to put in. I'll just read it to you. I think I read it the last meeting too. Bear with me here. So the private wastewater septic system review will have a variable fee depending on the complexity of the septic system review. And I know Roxanne and I were going back and forth. Plymouth charges $750. And what would have to happen is I'd have to work with Lisa Cool, financial analyst, and Amy Dexter, our accountant, and set up a sub fund. And the sub fund, let's say it would be either $500 or $750. They would upfront the, let's say $500. And depending on how much Paul Brogna charged, if it was only $400, we would give back $100. So they couldn't get the certificate of compliance in the end unless they paid the full fee. So I guess the question is, Plymouth charges $750, and I'm not sure what you wanted to charge $500 or $750. As I said before, we've been charging about $150, but we're going to have to recoup the cost. Whether we charge, let's say we charge $750, as I said, and it was $600, we give back the $150. But if it was only $500 and it really cost $800, we'd have to, at the end, when everything's all done, charge the homeowner another $300 to get that certificate of compliance. So it's up to the board if you wanted to make it, you know, $500 or $750. You know, I will say another thing that I'm just thinking about in my mind. Sometimes these septic plans, and my staff know this can go on for years. So they can go and they can start fixing their septic systems. And then, you know, they need the certificate of compliance to sell it. So if they're going to be selling the property, they need to pay it up in the end. So it could go like that. I mean, we could get $500, but let's say they want to go sell in 10 years. They still wouldn't have their certificate of compliance if they didn't pay up with Paul Brogna. So they could be like $300. We could be waiting for money too for a couple of years. Because, you know, my staff are on the call, that these septic plants and what people can be sitting on there and not getting that certificate of compliance like right away. Some people don't get that certificate of compliance right away. And then they'll come back a couple of years later and they'll say, oh, I need that because I'm selling my property. So so it's up to the board. We'd have to figure it out with this sub fund, as I said, with Lisa and Amy. But I don't know if you wanted to charge $500 or $750. I mean, it'd be up to the board what they think.
It
So,
seems
guys-
more like we should charge the $750 and give it back if we need to, in light of the fact that they may wait several years, but they won't wait if they're getting money back or if they think they are.
Right.
The only thing I would say is I'm probably more inclined to go with the 500 because I think it's a huge jump from what we're doing. And I guess I don't have a real breakdown of what, I know you have highs and you've had lows, right? So how many did we do, for instance, over the past year? How many were 900? How many were 300? You know, I don't have that information. So
Well, I have it here. Jean brought it, the information
is
to
it in
me.
here?
Yeah,
I don't,
I don't know if it's in here. Can you see this? I mean, there is only really two one's 900 and one's 910.
and then what's the one right below that?
490, 675, 675, 350, 420. There's two 700s, a 910,
How many in a
487.
year?
So that's the thing. It's interesting because in FY23, it was over 8,000, 8,330. FY24, 9,250, but FY25 only 2,115, which is like, wow, we're not getting many septics in, which is very surprising. But people seem to be so much busier in 23 and 24.
Yeah. I mean, if you do the 500, I'm just thinking of this. So if you do the 500 and then you say that there, if it's over that, you're going to be charged at and you can't get your
Certificate of compliance.
certificate. I mean, it would be good to know what the breakdown was, I guess, because I mean, if I look at these fees now and then I'm going to jump to 750 and then it just seems like a huge, I mean, you know what I mean? I don't know, that's just me. Because I'm just looking at it now. If you have just on the Milton one, you have 150 for new construction, existing system repairs like 75, plan
Right.
reviews 100, plan revisions 50 per revision. I mean, if I'm going from those prices and then I'm going to 750, yeah, it's sort of a huge jump, even if you revise it, you know, 4 times or something. And would this be, I guess my other question would be, would this be a separate revolving fund for which you would pay Paul Brogna out of, or how would that, you know, going forward end up being done?
So Lisa Cool, I'd asked that about revolving funds, and she said no. It'd be some kind of sub account that they would keep internally, and Jean would be managing that, and Lisa would be overseeing it too.
Okay.
So they'd have to create a spreadsheet and follow it along as people are asking for the certificates of compliance, and then following Paul Brogna how much he's invoicing for properties.
Because I'm just looking at some of these other ones like Medfield, 330, and this is a higher end one, right? I think Medfield, I think they tend to have probably more of these systems than Milton does. 75, and then the plan review is included in 330. So I don't know. I feel like, with the exception of Needham, I feel like we're sort of right now in the right ballpark, but we know that it costs more because we have the consultant and so forth. So I think we should raise them, but I wouldn't go to 750. That's me. That'd be my opinion.
Board, would you like to vote on 500 then? And then we can collect the rest of it when the certificate of compliance is issued, that they'd have to pay whatever Paul Brogna, the rest of the money that he invoiced for.
Well, the question I have on that is, we have to pay Paul Brogna anyway. So where are we getting this money if they're not paying it at the time? You know, if we
So-
have to wait 5 years to collect that extra $500 to, or however much.
That's
Really?
right. Yeah, there'd be a deficit. There might be that deficit for 5 years, right?
How often does that happen? And do we have, I guess I don't have enough. I guess for me, I would want to see a little bit more data then, a little bit more of a breakdown on this before we vote on it then, because I'd want to know how many seem to be in the, 300 and under, how many are, 3 to 500, how many are, you know what I mean? Like a breakdown of how many cases over the last year, for instance.
Yeah. Are more of them over 500 than not?
Yeah, I mean, because if 75% of them are, you know, under 500, then you might
Mhm.
break even, and then like the next year you might decide to increase it a little or something. I just think,
Mhm.
you know, people are looking at this and then you're just going to jump to 750. It just sounds like a big jump. That's all I'm thinking. If you're somebody who's a $300 one, for instance, you know, I don't know, just my thought. I mean, I just feel like before we decide, can we get a little bit more data, a little more backup data on it
Yeah, I mean, I can
for the
have,
next meeting?
I can put together this chart and break it down further, if that's what you're looking for.
Mhm.
Well, I'm looking at, for me, I would be looking at, okay, last year we had 2,000 systems. We had 300 that were between $300 and $400. We had, you know what I mean? Like a breakdown of that number wise. So we have an idea. And maybe we do go to 700 or 600, but you know,
This is the 2023 to 2025. Gina, these are all the ones that have been broken down from 23, 24, and 25? I see Carolyn has her hand raised too. Go ahead, Carolyn.
I just had a question because I know I mostly deal with the permitting with these septics.
Yep.
So I know right now we have the engineers and the installers are the ones who pay for the permit. So would they not do that anymore and the homeowners would do it? And then I'm also thinking with the COC, the certificate of compliance, usually we give it to the installer when they finish everything. So I just don't know how that would work logistically with the setup we have now with Permitize. I just don't know if that would mess up how we already run things.
We'd have to work with Permitize. You're right.
Mm-hmm.
I guess so, to Carolyn's point. So isn't it the contractor that pays the permit?
Usually, yes. So, like, when an engineer comes and they do a perk test to see like the rate of how much the water flows, the engineer pays that, the installer pays the trench permit, and then they submit the plans. And then, depending on how much we tell them it costs, they'll pay to have the plan approved and reviewed. And then when the installer comes to actually put in the system, they'll pay it when they finish.
Okay. So basically, it sounds like Caroline, that it's not really the consumer unless that cost is passed on to them. But the rebate really would end up going to the installer or the person who pulls the permit, is what you're basically saying then. See, that's why it's confusing to do a rebate. That's what I'm saying. I mean, it's almost better if you do, like Laura said, either 750 or 500, with the caveat that it for the installer, that it could cost more depending on the review. Because it's never really going back to the homeowner, right? I mean, that's what it sounds like.
I would imagine the price of it is passed on to the homeowner.
Yes.
Right, but we're not rebating the homeowner.
Right,
We would be stuck, it's in stock, but we'd be rebating
yeah.
the installer or the person who pulls the permit. So I don't know. We have to think about that then a little bit, I guess. Because I think Carolyn brought up some really good points there on how it works right now.
Mhm.
Yeah, I think it would ultimately, well, when talking to Lisa, it would be rebating the homeowner. But then the question
Yeah.
becomes, yeah, how much is this going to cost the homeowner?
Well, I mean, I think the question is, why would we be rebating the homeowner when it's the person pulling the permit, right? I mean, I guess my question is, if they want the compliance certificate, it sounds like it goes to the company that does the work, right?
But
Not
then
the
why do they
homeowner.
wait several years before they
Yeah,
go for them?
Is they're selling their house then? They'll
No,
need the
but if
no,
no, but if the certificate of compliance is given to the company that
did the
built it,
work.
or yeah, then
So
why don't they go look for it right away? Why wait? I mean, I understand they're waiting until they sell their house, but the company that did the work, why aren't they getting the certificate of compliance before the homeowner pays them whatever they charge. Does that make sense or no?
No, I understand what you're saying, because it just doesn't make, it's like, why would you have an outstanding certificate a year later if the contractor's already done the work and paid, right?
Right.
Then the town should be issuing a certificate of compliance, right?
And I imagine that the homeowner wouldn't get a certificate of compliance if it was done wrong, in which case they wouldn't pay the installer.
Right, or if they did not pay the installer, right?
Right.
If they like held out money on the installer, then he's
Yeah.
not gonna give it to them, but like, so this is a tricky one, I think, Caroline, in terms of who you're gonna give money back to and this, and that. It almost seems like you gotta do a flat rate, and then any additional, will be more money to, for these reviews and stuff, and then, similar to what you're doing now, basically, where you have these different categories.
Mhm.
Maybe it's a flat rate in every review, or extra time is more money. I don't know. I'm just saying, I think that actually Caroline brought up that really good point. So I don't understand if the contractor is pulling the permit and paying the permit fee, why would the homeowner get their money?
Unless the contractor pulls the permit fee, pulls the permit and immediately asks the homeowner for the money or prior to pulling it, gets paid by the homeowner for whatever the cost of it is, then.
But who's
If
gonna
it's-
chase that down? I mean, like, would we be responsible for chasing that piece down? Like, whether it was the,
No, because
you
what
know
do
what I
we
mean?
care as long as we were getting our money, right?
Yeah, that's what I'm saying. Like, would we want to have the responsibility of chasing down the homeowner or the contractor, or it just
Well, I
seems
think that the
weird.
homeowner would always be on the hook at the end of the day because,
Well, to get the compliance certificate, but I'm just saying, if like, if they paid it, if it was paid and then we had to rebate somebody, and you know what I mean? Like, it's just, it's a lot of work to, first of all, to be starting to rebate people. I think you're better off with a flat rate, and anything extra you have to pay over that.
Or maybe, I'm just thinking, the installer would be applying for it, but they wouldn't know the exact answer of how much it would cost Paul Brogna until it was done, until Paul Brogna looked at it. So let's say Paul
Mhm.
Brogna spent time looking at it, and then it was $500. And then we would tell the installer, it costs $500 for Paul Brogna to approve this. The installer would have to go back to the homeowner and say, it's gonna cost $500 for me to move forward. And then the homeowner would give the installer $500, so they put it into permitize.
Right, but if it ends up being more than that after that point, then what?
That's why we have to say it's a variable fee, depending on the complexity of the septic system. I mean, we can't tell at the beginning how much a system's gonna
Right.
cost. There might be, they might have to come to the board, they might have to do a sieve analysis. And so it could be, more than $500. I don't know if we can leave it open. But if we leave it open, it could be, $900, and we have to kind of say like,
could we give a variable fee, say ranging from 300 to 1,000, depending on. If it has
Complexity
to,
or the
yeah, if
whatever.
it has to be done, it has to be done no matter what
Right.
the fee is.
right?
Just
We
put a
could do that.
description in, just put a description in of the different things that are involved and just leave it open-ended, just.
Mm-hmm.
I like that it could be 300 to 1,000, because it could be.
Yep.
Yeah. Just put a range. It could be in excess of whatever the highest amount is that you put for the range. It can exceed that too.
Well, you could make the range as high as you want, and even if it never goes above 1,000,
Yeah.
you can make it between 300 and 1,500 if you wanted
Yeah.
it.
Mhm.
If it doesn't generally go over a certain amount, then I think. I don't know.
Yeah, I mean, a lot of options.
Yeah.
Can we think about this for the next meeting, or do we need to decide this tonight?
You know, we would have had to decide it tonight because, you know, if we didn't get a passing of the budgets and stuff. But the town administrator wanted us to remove the $7,000 from the
Mhm.
budget to pay Paul Brogna, but it did pass, so the money's still in there. But I think, you know, by the next meeting,
Mhm.
hopefully you'll have more information and make a decision.
Yeah, I mean, I was, we could think about how we want to do it, if we want to do a range like that, or we want to do a number and then it could possibly be more, however we want to do it.
Yeah, that's a good idea, Laura. You said that,
Yeah,
that range.
Yeah, that's a good idea.
yeah.
All right, let me break down some more of the numbers and give it to you guys.
Yeah.
And we can revisit this again at the next meeting.
Okay.
Sure.
Sounds good.
Good. Sounds good. Okay. All right, number 7. I just keep this on the agenda, the opioid abatement funding, spending, and community outreach. Just to let you know where we are with Sky, who's our consultant. We've had, she's gathered all the data with the focus groups, and she's presenting the data now. Unfortunately, I was pulled away last week and couldn't hear her presentation. She did a presentation for Emily and Anne about what she found. And then we're going to be meeting with her again tomorrow. And she's going to go over tomorrow, Wednesday or Thursday this week, to go over more information that she has gathered in the community assessment for the opioid abatement funding. So I just want to let you know that. And then hopefully by the next board meeting, we might have some strategies of, the best ways to spend the money. I'm hoping that. So I'll leave that on the agenda and we can talk about that further. Okay. And any questions about that? Okay, moving on to number 8, community health improvement planning. The CHIP discussion and vote to approve. So I'm just gonna take a look at this plan. You all got a copy of it. I'll direct you probably to the last 2 pages under the Community Health Improvement Plan 2025 to 2030. So this is a 5-year plan and the goals. So there was, we're waiting to get a little bit more information to kind of finish this and have you vote on it. One thing that came up, the top one, Health and Human Services Consortium, the responsible entities. I spoke to BID Milton Hospital, Lorianne Marquez. She's the communication director. And initially she said that BID Milton Hospital would run this program and be responsible, but she kind of stepped back one step and said that BID Milton Hospital would be able to provide a room, provide the food, but that, we'd have to seek out, any kind of speakers or plans on that. So I put Milton Health Department as the entity and BID Hospital as second on that. And I'm not exactly sure what that's going to really look like, and I'll have to explore that with Laurie Stillman. The description is a consortium of government and community reps who collaboratively share information and address the needs of vulnerable residents. So we had to kind of change that one a little bit. Another one that was kind of questionable, and we're on the last 2 pages, is the intertown transportation under responsible entities, the master plan implementation committee sunsetting. And so we really didn't get an answer of who's taken over for that. And I put to be decided. And the Partnership for Healthy Milton wants to continue to explore that avenue. So that's kind of where we're at with that, with the responsible entity. And then food insecurity, I did add, let me see, Milton Health Department via the Mass in Motion Partnership. I think that's about all the changes that we had in our final meeting. Is there anything that the board is seeing with that plan that they'd like to talk about?
Caroline, just regarding the intra-town transportation, free shuttle. So you have to buy a shuttle, insure it. Somebody has to be licensed and have a special license to drive it. They'd also probably have to be, if they have elderly people in the car, they have to know CPR, first aid, and, you know, kind of stuff like that. How is that going to be free?
It will have to be paid for with town money and residents' money. Yeah,
I mean,
I don't know
it's
how
free
unless
to it's
it'll
free
be
to,
free to.
it's free to everyone in the town. It's just free to elderly, or like what? Free
So
shuttle?
Everyone.
I
That's
you're
not
right.
what?
They'll either have to get grants or it will have to come out of taxpayers' money because I don't know how that will be free. I
And
don't.
there's a lot of liabilities with that too. Does
I think the cost is huge. I mean,
that's
some
exorbitant.
places have gotten rid of them. I think Dedham had one and they got rid of theirs.
And there's a lot of
Yeah.
misuse with them as well. So it's like you need a lot of guidelines when you have something like that. It can't just be this, you know, laissez-faire kind of approach to the use of this shuttle. It would have to have pretty rigid guidelines so everybody could use it for something important, not just going across town to play bingo or whatever. It's just, and what would the hours be? And
Well, I know that
quite
Deborah
broad.
Milbauer explored this with the master plan implementation committee. And I think that they may be doing some kind of maybe a survey or some kind of an assessment, but I don't know anything about that. Like, I don't know if that was approved. I'm not sure what that would look like. And you're right, who's going to pay the costs and who is going to be using this shuttle or vehicle? It doesn't say who that would be.
I mean, it would be, you couldn't have somebody under 18 years old. Like they have to be a legal adult. You can't just, you know, you can't be, it can't really be for all residents. Am I right or am I wrong? It can't be.
Well, so I was on the master plan implementation committee, right, as that was one of my subcommittees. So Deborah Milbauer came in and she was presenting this and looking to have a student do some research on it, like what other towns have done, you know, how did that work out, who paid for it, you know, all this stuff. The problem is there was discussion about this, but it was going to involve money from the master plan implementation committee. And then the last meeting that I was at, there was an option to do it as like maybe a capstone project for a grad student, and it would be no cost. And that's what they were going to do just to get some preliminary research. But I don't know, you know, I've heard they've had another meeting since I've been off, and I had heard that they were now looking at some money with it again for the research. So I don't know. My understanding from our last meeting before I was off of that committee was that we had agreed that, you know, getting some background research, looking at other towns, like just gathering information, what worked, what didn't work, how do you pay for it, you know, that just, and maybe surveys and things like that, that a grad student could do that. And there would not be a cost because we didn't want to incur costs for any of that stuff. So I don't know where they're at now with that. And there was question of whether it would be something like a, you know, even if there was some kind of service, would it be like almost like an Uber where you call and they pick you up and take you somewhere, or would it be more like these are the stops and things? And it's a hard concept to, you know, it's a lot of information, a lot to try to figure out.
Yeah, and it's bound to staying in Milton. Is that correct? It would be staying.
Yeah, it would be for
in
Milton.
Yeah.
Yeah.
I would hope so.
Does the Council on Aging have a shuttle for elderly? So,
They do.
I mean, if it's for younger people, they can get a ride from someone, a friend, I mean, the attention needs to be paid to the elderly with this, I would think, not other groups. It says
I know, it would
improve,
seem like they would be the most,
it says
would be
improve
using it.
residents. It doesn't have any kind of age parameter or anything. So,
Right.
I did ask our social worker, Ann Grossman, if people are calling to ask about rides, and she indicated no, that she hadn't
Right.
heard there was a need for a shuttle or,
my mother used to take the ride. The ride was great.
Yep.
It picked her up and took her all the way out to Julia Ruth Adult Daycare in Westwood. It went to Winter Valley, and she took the ride. Yeah,
Yep.
she didn't always like it, but on the days where she couldn't get a ride from one of us, she had to take the ride, and they were really great.
Yep.
They were wonderful. And now I think the process of getting the ride certificate, getting approved, is a little easier. You used to have to go over near Charlestown or over near the Bunker Hill Monument and go in there and get go through the process. But I think now it's a little more forgiving.
so would you like to remove that from the strategy of the intertown transportation?
It sounds a bit redundant to me, and yeah, I mean, I think I would motion to say that. Unless somebody
mean-
else.
I mean, if we did the research on what towns, maybe find out a little more about what other towns who have it, what it costs, how they work it, all the details.
Yeah.
It might be better to do that, just look into it a little more.
Yeah, okay.
It is a 5-year plan. So, 2 years or 3 years down the road, we could get more information.
Mhm.
Okay,
about
right.
this.
True.
Yeah.
It's like a snapshot in time right now, but things could change or money could open up and in different areas. Maybe someone else, Partnership for a Healthy Milton could be exploring it. And they
Mhm.
could, I don't know, get some grants in the future, 3 or 4 years down the line and,
Yeah.
get some buy-in from some partners.
It
That
is
could be a
expensive to
possibility.
run them though, for sure. I mean, that came up with many
Oh,
people
yeah.
when we talked about this at MPIC. It just, some places that run it are more like touristy kind of places that have those kind of things. But for the purposes of what here, we'll see what they come up with. We'll see what, information, but it sounds like it could be quite costly because you would also need to have somebody dedicated to drive it.
Right.
So that's an employee.
Mhm.
And that's, because somebody had said, well, maybe you could get someone to donate the van or this or some form of transportation. But then actually someone else had brought up, well, that's great, but you still need an employee, an FTE, and that comes with benefits. And, that's a whole other thing. And, to assess the need, if there really a need, a strong need for things like that.
Mhm.
So.
So would the board like to keep it in?
I guess we'll keep it in and do our homework, do some
Mhm.
analysis like Laura said.
Yeah, I think the analysis would be important.
Is there anything else that's strategies or responsibilities that's jumping out at you?
I think it looked good.
Would you like to approve that then tonight?
Sure.
Sure.
You make a vote?
I'll make a motion that we approve the community health improvement CHIP to approve the final vote to accept the plan, I should say.
I'll
Anyone
second it.
second? All in favor? Aye.
Aye.
Great. Thank you. Okay, moving along to number 9. So appointment of the Massachusetts Health Officers Association staff as a tobacco agent for Milton to conduct compliance checks, discussion, and vote to approve. So this is Sarah McColgan again, who's been very helpful to us with our tobacco regulations. And the MHOA has received grant funding, and the MHOA is reaching out to NC8, all the communities, to see if, do we need any help with our tobacco inspections or our compliance checks? My staff have done the tobacco inspections, and actually Sarah McColgan, did help with that last year. And she said that she could come out again this year and go with them to at least one tobacco establishment. But more importantly, around compliance checks, I don't know if you remember all those years ago, Roxanne, when we did compliance checks, and that was many years ago. So we were able to do it once, but that's more complicated because MHOA would be able to handle this. And this is getting an underage, like a teenager, to go into the tobacco retailers to try to purchase, cigarettes or dip or, and then see if they can purchase it. And then, we did that once that I've been here, and it would be great if, they do this. That's what they do. They run these programs, and they're able to bring in, these underage youth to be able to go in. They'll manage that, to go in and see if they can purchase, without the, someone won't ask for an ID. That would be it. That would be, they could purchase the tobacco without an ID. And then they come back out with the tobacco, and then MHOA would report to us and tell us, what had happened. And then we would go ahead and fine the tobacco retail establishments. It keeps them, on their toes. They should be asking for ID. And so we want to make sure that they're not selling to underage residents or youth that go in. So we did that many years ago, but I think it would be great again to have MHOA on board to help us with those compliance checks.
That's
And
good.
so they sent over an MOU that has to be signed. I sent it to you this afternoon. And if you could sign that, Roxanne, and then come in and do that,
Sure.
that would be.
As long as the board agrees.
If the board agrees.
Sounds good to me.
Sounds good.
Okay, if we could vote. to
So do you
them-
have that in the office for me to sign?
Yes,
Okay.
Yep.
Do we need to take an official vote on that?
yes.
All right, so I'd like to make a motion that we appoint a Mass Health Officers Association staff as a tobacco agent for Milton to conduct compliance checks. And well, let's take the vote on this first. So second on the motion,
I'll second.
all in favor?
Aye.
So how long would this go on for, and how long is this approved for then?
For 1 year.
For 1 year. Okay.
It's for
And
1 year.
how many, so would they go out once or twice the year? Or how would that work?
They go out
Did they
once.
say?
I believe it
Just
says
once.
Yep,
Okay. Great, sounds good.
yeah, one underage compliance check for each retailer. Yep,
Mm-hmm.
and it's
Okay.
for a year.
Good.
It's great that they got a grant. They're able to help. That's great. All right, moving along to number 10, the health director's report. Just a couple things I just want to update you on. The first one is 68 Smith Road. Just to let you know that I was contacted by someone in the office that they said they were going to go ahead and file a permit, that they were going to do some work at 68 Smith. And you remember we condemned it last year. And I went up to inspectional services and spoke to Jay, and nothing has been filed yet. And then I went back to look, to see. It's important to know exactly when they received that condemnation notice, because they have a year to do something. And they know the clock is ticking, because Jay said that too. So I looked back to see, when was the certified mail delivered that they knew that there was a condemnation, and that was August 9th. So I talked to the state and confirmed that today, that it's when they actually received it by certified mail. But so they know it. They're on a clock that they have to submit what they're going to be doing to inspectional services. And I did speak to Jay to say, I know our concerns was the structural stability of 68 Smith Road, as that house or building that was once a school. We're wondering, it's been open to the elements for so many years, over 30 years, how stably structurally engineered, or what's the story with this building? I mean, we don't want somebody to go in and start some kind of construction and the building to fall down on them. And Jay said, no, they have to have an engineer before they start any of that. So that was our concern before. So as I said, there's nothing has been officially submitted upstairs up in inspectional services. So, if that deadline comes in August 9th and they still, haven't got their engineer to make sure that that building is safe to go into and safe to work on, then, we'll have to bring that to town council, and we can demolish that building at that time. We can move forward because it's already been condemned. We've been waiting, and here we are at the finish line. We're coming along, and still nothing has been submitted. So
I
we
think
can
the
move
other
to have
thing,
it demolished.
yeah, I mean, well, I think the other two other things, one other thing. I had raised that point to town council. I never really got a clear-cut answer from him. I think we should chase that down again. Whether or not the town, if they do decide to rehab it and they have an engineer, the town should be able to hire a structural engineer paid for by them, that we choose to review it, because we want to make sure that it's done correctly. And just from the past instances when we've dealt with them, I just feel that on this kind of a property, we'd want to make sure. Because it was very dangerous. I mean, we probably even shouldn't go in there. And my understanding is that they've been bringing people in and out, contractors, to look at this, which apparently they can, even if it's condemned. They're allowed to do that. But I think if they're going to do any kind of rehab, the town should have the ability to bring in a structural engineer.
So I'll
So
ask
we
that
should reach
question
back
to
out.
Jay. I can ask
Yeah.
that to Jay. I think that I already explored that, and
I
he
did
said
too.
if they have an engineer, I mean, it's the engineer's license. If the
It
engineer says
is,
it's
but
not, it's stable and it's not stable, and something happens,
Can
that
we
wouldn't be
ju-
good.
Can we just require that we okay their choice of structural engineer? Like, could be only certain companies can be used, something like that.
I just know that on certain projects that we've had in town, that the town has sometimes been able to require the person building that they would pay for the town's choice of who they want to peer review it, basically, like a peer review structural engineer kind of thing. So that maybe that's the best way to say it.
Yeah, I can ask
So,
Jay, all of you. Yeah.
Okay.
Let me look into that. Just want to give you an update. And then 5 to 9 Thatcher Street. Spoke with the state again today. So if you'll remember, I'm not sure if you were here at this time, Mary. It was back in 2020 when we first got our complaint of 5 to 9 Thatcher Street. It's the old Knights of Columbus, and then there's a house in front of it. And at that time, they did come to a board meeting. The owner did come to a board meeting. We had a correction order. They corrected everything. They cleaned up the trash. They secured the building, and we actually had the Abandoned Housing Initiative Tara Ruddle out there at that time too. The owner, maybe it was the owner's representative, came to a board meeting, and the board decided that time to close the case because they did, they secured the perimeter and the case was closed. That was back in 2020. Then in 2025, in February, there was a complaint that the fence was broken down in an area. My staff went out and they did see that. And so another order was issued in February. Again, the owner was contacted through their lawyer and whatnot, and they went out and fixed it again. So here we are again in middle of May. Again, complaints about a branch trees came down again on the fence. But not only that, we had another complaint about rodents. And this property has been more dilapidated over the last 5 years. The windows are broken. You can see through the houses, and it's more complaints from the neighbors that it's an eyesore. And another complaint was, I don't know if I said this, the rodents. There was a complaint of a neighbor right next to the property, and they said that rodents were getting into their house from this area. And yes, the grass has grown again over the spring now, and it looks all overgrown, trees and stuff like that. So spoke again to the state, working with them, putting together again another correction order, more extensive, because we found out, the water has been shut off there, the electricity's been shut off there. Now there's rodent complaints. There's overgrown grass, and rodents can be in the grass too. So we are Emily and Carolyn, because they went out and inspected again, and we're going to send that out. The highest amount of time that they can get to, correct this is again 30 days. So after 30 days, they will not be able to correct everything that we're seeing. As I said, everything's dilapidated, and the board will have to decide at that time to send a letter of condemnation to this property that's been sitting vacant for, it's more than 5 years. It's, if it's 15 or 20, again, it's similar to 68 Smith, not as many years, but a long, long time it's been sitting there and nothing has happened, and it's just eroding and dilapidated. And
It's also dangerous.
It's dangerous,
It's
yeah.
dangerous. I mean, I remember talking to
Right.
the fire chief when I was talking to him about 68 Smith Road, and I mentioned this one as well. And he said, we have those two on our radar. We know, be very careful going into those buildings if we have to. But ultimately, if there's thought that someone could be in there, they have to go in. So it is a danger to our own, employees as well.
Right.
Who owns
So-
that building, Caroline? I remember when they had to shut off the water and the electricity. I was at one of those meetings after an initial one.
Emily, do you remember who you sent
owns
it out to?
I don't remember. No, sorry.
Bring it up here.
Do they pay taxes on that building? I mean, the taxes up to
so-
date?
Taxes are all up to date. And and when we send out the letter, they do respond. Yep, right away. They'll respond. They have a lawyer overseeing it. So yes, I can send that to you tomorrow and show you the new updated correction order. But when we talked to the state, he said to, put on there that there's no electricity. The water's been shut off. And you're right, it's a hazard, because here again, the fence, has been knocked down. Any of the kids can go in through that house, and who knows what can be going on in those two buildings, the building and the house. So it's a hazard. It's a health hazard.
Yeah.
And as I said, we're getting increased calls from the neighbors. They're really complaining about it, and they want something done. They've been looking at this for a long time, and it's been not being taken care of. It's a health hazard. So we'll send out that correction order tomorrow. They're 30 days, and then they can they're going to have to respond one way or another, and the board should move to condemn, and that's what the state said.
Mhm.
I
Okay.
mean, at this point, it's a health hazard. So,
It sure is.
all right, so I'll send you that tomorrow. You'll
Thank
see
you.
that. I just want to touch base on a couple of other things. Just let you know that Sue's really busy with her camps and the pool openings are happening. There's some trash complaints that have come on our radar, 168 Brook and 172 Brook. First, we thought it was just one. It's kind of houses right next to each other. So the good news is that 168 Brook did speak to Carolyn, and they're going to take care of the property. So it's, I think, a matter of the occupants were putting trash into the recycling bins. They weren't picking it up. And then 172 had like couches and things out in front of their house, and they didn't have the proper stickers or whatnot. And the neighbors are complaining that things were being left there. So I do know that Marina DPW did go by and did pick up the couch that was there. So we did get a response from 168, sent out a letter to 172. So waiting for a response to that. Getting some chicken complaints, 18 Pope Hill Road, and a letter was sent out about that. The great news is that our two, and I just heard today about this, Roxanne, our the drug-free community project coordinators that we interviewed, we offered them the positions. That's Berlin, Awatch, and Anya Amidi. At 18 hours each, they both accepted the positions today, actually. So that's great. That's great. We interviewed them, myself, Roxanne, and Emily, and we thought that they'd be a great fit for the Milton Coalition. And so that's exciting. And then Amanda Decker, who's a consultant, she'll help us onboard both of them into the position. So Amanda did come to our last Milton Coalition meeting. She was great. She re-energized the Milton Coalition meeting. And so we're looking forward to these new staff and what they have to offer. So that's really great news. I'm really happy that they decided to come on board. So they accepted the positions. I think
sorry, go ahead.
No, go ahead.
I was going to say, to back up, we'll talk about the Botox thing in a minute, but mosquitoes. So the mosquito spraying and all of that, there used to be a process where people could do that, go online. And so have we had anything in the paper about that or out on?
I think I saw something. I think I saw it.
It did go into the paper, and it did go out through the, it's on the announcements for the Milton, on the Town of Milton website. So whenever they send it that they're either spraying or they're putting down the granular.
Larvicide.
Yep. Yes. When they're doing that, I send it to IT. They put it up on our website.
So with the spraying, people have to do that once a week, don't they?
So it's every Thursday that they can decide,
Right.
well, I don't want to be sprayed with the mosquito repellent they're putting out there, and they can go on to the website and the mosquito website, and then they can put it right in there that they don't want to be sprayed. Yep. So it's every Thursday when it starts up. And I know they've done the helicopter, so I think I even put out that they can do that. They can go and say no, they don't want to have that done, but they have to register their address right on the website. Yep. Yep.
And then the Botox.
Then the Botox. Yeah. So
Botox to beavers today.
Botox and botulism.
Yep.
And beavers too. Yep.
Yep.
So last week we got a call from the state on Wednesday that there was a suspect botulism case, and that came on Wednesday, and they asked my staff to go. I was at lunch. They asked my staff to go by Rodrigo Beauty. I'd never heard of them. So they did go by. The office was shut down. There was not even a nameplate there that said it was Rodrigo Beauty. And then I asked my staff to look to see if they even had a business certificate, and they didn't. But anyway, the health department does not permit cosmetology and like nails. So we don't permit them. We did have a call later on Wednesday at 3:00. The state had asked us, as they said, to go out just to make sure that they weren't operating, which thankfully they weren't operating. At that time, there was 4 suspected cases. And they said, the state was taking over this and that we'd get direction from the state. I had asked, should I put out something about what was going on? And they said, no, they were going to take care of it. So I said, okay, I'll wait for you. They asked us to get more information about who owns the business, which I was able to provide to one of the epidemiologists who owned it, and gave them a phone number and an email. And then they followed up from there. And then on Friday, I spoke to you, Roxanne, and they did put out a provider's notice, and it was an advisory, but they didn't want to push that out further. And so I took pieces of that advisory and put it into really an advisory for Milton residents. And I put that out on the website on Friday. Just taking pieces of that because I wanted to alert people that something was going on the South Shore. We couldn't say it was Rodrigo. Now I can say it's Rodrigo because it's out there. Channel 5 News exposed that it was Rodrigo. It's out in the media that it is. And so they were operating in Milton, also in Braintree. So at that time on Wednesday, the state was also calling Braintree, and they were calling that health department to say, go out and find out about Rodrigo in Braintree. So I haven't heard anything from the state yet. We did, as they asked, to try to get more information about, the building and who was giving him space to run his operation. But since that time, I haven't heard anything except for today. Over the weekend, I found out that it went up to 10 cases. Again, the good news is we're not seeing any Milton cases come through our queue. So they're coming from other towns and these people that have been exposed to this are very, very sick in the ICU. I mean, really sick. So they called again, the state called and said, like today, any cases in Milton? Have you heard anything? Is anybody calling you? And the good news is nobody's calling us. So no one has called the office to say, I've been exposed or whatnot, because if that happened, we'd have to refer them again to the state. So the good news is I haven't heard any Milton residents have been exposed, but, I hope they come forward if they have been exposed, so we can refer them to the state. So I'm not sure how large this is, like what is going to be happening with this. But, at that point on Wednesday, I was like, who do we have to tell about this? And I did tell, the chair and town administrator. And I said, over the police, and they said, no, we're going to take care of this. I said, okay, that's fine. But then today, the police did come in. So they did want to have a conversation with myself and Sue, just to get all the information, because they're following up on this too. So kind of been a little whirlwind about this. So I don't know exactly what's happened with the Botox. Was it not approved, FDA approved Botox? Was it from another country? Did they inject it improperly? Was it an incorrect dose? Like what happened to these people? So they're going to be gathering all this information, and it's going to be an investigation. Yeah, because
Has anybody died from this yet? And did they say there were 10, they said 10 cases. So have they say there were any more? And did they say anyone has passed from this or?
Well, thankfully I haven't heard that.
Okay.
But I've heard they're very sick.
Yeah.
So I'm just, trying to get more information from the state, but this is the first time they reached out today to say, like, they're creating some kind of a survey. And when they create it, supposedly I'm supposed to send it out. And maybe the survey will say, like, have you been treated by Rodrigo in the past? I don't know what the survey, I have no idea what this is going to look like. And so they're creating something on their end. But this is, as I said, we don't permit. this is cosmetology and this is the state, so we don't have anything to do with this. We were just helping as we could help as the health department in this
Well,
investigation.
I think it was concerning too, because when Caroline first told me about it, they were very particular about, you know, you don't need, we're going to send this notice out to providers. And I said to Caroline, I said, we need to put something on the website, you know, because people, providers, who knows? I mean, we don't know
Yeah.
if this gentleman was a legitimate provider or not. And that's not even the issue. The issue is more like, we want to make sure the public knows what's going on. And so we didn't have, that time we couldn't put Milton in it. We could say South Shore. And then I said to put the signs and symptoms up there too. But I thought it was troubling to me that the state wouldn't have said, put something up on your website, just basic, you know,
Yeah.
as to, you know, if you've had Botox, you know, recently and developed these symptoms, you know, please reach out, you know, could be this or something. It was just concerning they didn't push that.
Because not only do they have to track Rodrigo, it's wherever he got his stuff. Where else? What other places got that same lot of whatever they administered?
Yeah.
You know, the lots are very big, and the strain of whatever was in it could have been sold to many other places or bought
Right.
on a black market or something. Who knows? I mean, we don't know.
Hmm.
We're gonna find out. Oh boy.
Should we be permitting these people? Can we? I mean,
That's what I was wondering too.
we can't.
No, it's like the state operates, and it's the cosmetology and barber licenses. And like the state does the nails, all the nail salons too. We don't go into the nail salons.
Oh,
They
yeah.
have, you know, they have staffing to go
Yeah.
in. They know what they're looking for.
Just seems like when they're injecting things
Yeah.
into people, you should be able to go in and just even judging their cleanliness and whatever, you know?
Right.
Agree.
Didn't pull a business license either, did they?
No, that's the first thing I said
But to run a
Susan.
business, you
Never-
know, so.
Never heard of Rodrigo Beauty. I said, go across the hall to the clerk's office, check
Yeah.
with Sue, see if they have a business license. And they didn't. So I said, oh, that's not good.
No.
That's not good.
Mm.
So.
How long has he been at that building? How long has he been there? We don't know.
I don't know.
Okay.
Well, I'm sure there'll be more information forthcoming soon, right?
Yes,
Hopefully not more cases.
I hope not.
So,
Anything else, board?
No.
nope.
No.
What, December 11, a future meeting date?
Sure. Oh my gosh, it's gonna be July.
Yeah. I don't know what my work schedule is in July. Let's see.
What are you looking at, Caroline?
14th or 21st? A Monday? Do you want to keep it on the Monday?
I can't do the 14th. I'm away then.
Okay.
I could do the 21st.
How does that look for you, Laura?
Yeah, the 21st works for me.
Does that look
Okay.
good?
Do you want to do the Zoom again, the 21st?
Yeah.
Does that work for you, Caroline?
Yep, that works. Want to do 7 p.m.?
Sounds good.
All right, sounds good.
Thank you.
All right.
Okay.
Thank you.
Thanks.
Thanks.
Good night.
All right.
Good
Good night.
Hey.
Good night. Bye.
And the meeting is ending at 9:01.
Thanks.
Yeah.
Good night,
Adjourned.
everybody.
Good night.
Good night.
Good night.